Amy Klobuchar, the Democratic senator, appeared on MSNBC to tout the fact that President Biden has unveiled the 10 prescription drugs that will be the first round of negotiated drug prices that Medicare will engage in negotiating down. And we've been waiting to see which particular drugs would be named. She'll talk about this and advocate for the impact this will have. And then we'll go through some specifics through the lens of an interesting Washington Post article. This is huge. Of course, it came from the Inflation Reduction Act, the ability for Medicare to negotiate drug prices. And it's not everything we could have hoped for, but it is a step in the right direction. And Amy Klobuchar will make that case here.
So this is a huge deal, Willie. We have been working, I've led this bill for decades, and finally, with President Biden's leadership, with AARP taking on the pharmaceutical companies on behalf of 50 million seniors and other senior groups, they're going to end their sweetheart deal, pharma is, where they were able to get and charge whatever they wanted to. So the drugs that have first been announced, these are just the first 10. Each year there's going to be more and more drugs, are things like Eliquis and Xarelto. Nearly 5 million people are enrolled in Medicare taking those drugs. That's for blood thinners dealing with heart conditions. Things like Jardiance and Januvia, which are diabetes drugs. Things like Enbrel, which is a drug for arthritis and psoriasis. So it's an incredible game changer because they have 3 lobbyists for every member of Congress. They have run multi-million-dollar ad campaigns in order to lock in their prices. And President Biden and a group of us in Congress, Democrats, finally said, that's it. We're taking this on, and that means negotiation, just like you have with the VA, for prices for 50 million seniors in America.
So there's 2 elements of this that I want to go through. The first being just the specifics of the policy. It's important not only to talk about the passage of different policies, but also as they get implemented, because administrations have a big job of properly doing that. And so seeing as it actually gets followed through on. And then also, as we go through the details, keep in mind that this is what the right wing calls radical left, communist, Marxist, fascist. And we've talked about how, yes, out in the world, on social media in particular, based on the algorithm prioritizing engagement, thus provocation, of all different political labels, you can find people who sound really extreme and are really extreme and radical, and we do have a polarized environment, all of that. That does not reflect into positions of power. Thus, it is not the same magnitude of an issue on both sides. So don't let people do that. It's completely dishonest to pretend both sides are going in radical directions, not in positions of power, which is the relevant part to our political conversation. If you just want to take issue with on Twitter, something someone says, and they identify as a liberal and they're sounding really extreme, go for it. But I'm talking about positions of power. Again, what I find to be very relevant to our political conversation. Right now, massive problem with extremism in the Republican Party, and they're making it to positions of power. Not the same in the Democratic Party. And that reflects in who makes it to those positions and what policies get implemented. And this is an example of that. You'll hear Biden's doing this and wokeness is going to end your life and Biden's going to come and take your beer and your gas stoves. In reality, this is what he's up to. This is what Biden's doing. This is what Democrats are actually doing in terms of their policies. So this is from the Washington Post. Biden administration names 10 prescription drugs for price negotiations. The Biden administration Tuesday identified 10 expensive prescription drugs that will be included in price negotiations with pharmaceutical manufacturers as the government seeks to ease the financial burden on older and disabled Americans, an unprecedented step in a long political war over the nation's exorbitant drug costs. Medications could be targeted to see kind of how they chose which ones to negotiate. For price negotiation, if they are available under Medicare drug benefits, lack certain competition to push down the prices, and have been sold for at least several years to give drug makers time to help recoup the expense of developing them. And as we kind of talk about this, you can picture previously Medicare would just walk into the metaphorical store of drugs and just, all right, this is the price on the label, we'll purchase it. Now they can go in and say, we buy so much that, hey, drug maker, let's have a conversation. But they'll only do it with certain drugs based on a broader set of variables. Some of them touched on there, so they don't suppress innovation. I understand, though, that is used as an excuse to justify massive unnecessary profits, often, and price gouging. So it is a balance, but hopefully we can get that to tip more in the direction of maximum negotiations. For sure, we're starting with 10 drugs. Hopefully they'll roll out many, many more over the next years. And it does note, though, the number of medications and the timing of this first price reduction, 2026, are less ambitious than some Democrats have sought for many years, even though it is still significant. And it is changing the paradigm. Finally, at least negotiations and Medicare fighting for lower costs is on the table. When last year's law passed, the Congressional Budget Office predicted the negotiations would save the program slightly more than $100 billion during the following decade. Why would you oppose that? It's ridiculous. Radical left socialism. All told, HHS estimates that about 9 million seniors enrolled in Medicare's prescription drug program used one or more of the 10 drugs in 2022 and paid a total of $3.4 billion out of pocket. So for those drugs, there's $3.4 billion out of pocket that could be worked with to try to get that down for Medicare recipients. And 9 million will be impacted by this first round of drugs on the list of those being negotiated. If a manufacturer refuses to negotiate or won't agree to what federal rules call a maximum fair price, the company will face a substantial tax or must withdraw from Medicare and Medicaid, the nation's largest public health insurance program designed for people with low incomes. And it continues on, but we'll stop there so it doesn't get too boring. But as you can tell, these are really common sense steps being taken. And I think Amy Klobuchar explained in some good terms some of the impact and some of these specific drugs that will be noticed in people's lives, seeing those costs hopefully go down. And it will also, generally separate from out-of-pocket costs, save money for the program, as it noted, $100 billion over 10 years, which is saving the taxpayer money. And that is what you would call fiscal responsibility. Why let companies continue to price gouge the government and price gouge Medicare recipients? And obviously, you also have the whole private market that will need to be addressed as well. And lastly, I'll say another element of the Inflation Reduction Act in this same vein was capping the cost of insulin at $35 out of pocket per month. And Democrats tried to apply that to all Americans. Because of the specifics of the budget reconciliation process, they were able to, without the obstruction, or I should say, they were able to, despite the obstruction of Republicans, get through the capping of insulin costs for Medicare recipients specifically. But because of the obstruction of Republicans, they weren't able to apply that to all Americans. So just know, day to day, these things matter. Having so many Republicans in positions of power instead of Democrats prevents really good policies from being implemented. And we could have more solutions being implemented and more problems being solved, or at least addressed in part. Again, I'll note, as the article did, not far enough, plenty of criticisms, but it's something. And we could have more of that if we continue to try to get people active and vote against the Republican Party. Thank you so much for watching. If you want to be a part of what makes this show possible, plus get access to the full video version of the show hours before all the clips are able to be uploaded to the YouTube channel, plus get the bonus show on the weekends, you can do so by going to lukebeasleyshow.com/membership. That's lukebeasleyshow.com/membership, and there's a link in the description.